I would say if you're losing hope, to share my hope. Since I was a kid, I've known that I've always wanted to go into healthcare. I just knew it. And so eventually I became a nurse. I worked as a registered nurse for about 7-8 years. And I spent time in a couple different specialties, but the bulk of that time was as a hospice nurse. So I specialized in both adult and pediatric hospice. And I've always considered the end of life to be, for lack of a better word, just a sacred time. And I just found it very moving, and it touched me. And, 1 out of every 5 people in this country have mental illness. And it was something that I encountered frequently, and I knew that I could help these people. I could handle it. We hear a lot of disturbing things on a daily basis, and it has really forced me to develop stronger boundaries and to learn to take care of my own mental health. Because you can't hear the type of trauma that we do on a daily basis for years on end and not be impacted by it. So it's forced me to seek out my own therapy and learn different ways to manage my own stress. So in that way, it's impacted me. And I've learned that when you don't process this information and manage your anxiety or stress well, it comes out sideways, I always say. So it can impact, your family, your friends, your relationships. So it's been something that's been challenging, but definitely worthwhile. It's been challenging managing my own stress and processing the type of information that we hear on a daily basis. So that's for sure been a big challenge, but also helping patients understand that mental illness is real, even though they experience it. Stigma is so strong in our community. I often have to convince people who are experiencing depression and anxiety that it's not a choice. Like, they're not lazy, they're not doing anything wrong, that this is indeed biological. And so reducing stigma and providing education has been challenging. I've seen so many lives changed. People have come to me at their end. They thought, there was not going to be a tomorrow, and I've been able to help them stick around, and I've seen major transformations, and these people who had the courage to come to me seeking help, and now they're able to start a new chapter and have an entire just a new life, new beginning. So that keeps me motivated to continue. There's also just a total lack of resources and other people willing to do this kind of work, and so that keeps me in it too. Thanks for watching, and on this channel, we talk about all things mental health from the provider's perspective. So if this is of interest to you, please click that subscribe button and that bell, and you'll be notified of future videos. And if you live in the Southwest Washington area or Portland, Oregon, please reach out to TMS Northwest. We'd love to help.